So in this next video, I'm going to talk about leukemias. And so there's four types of leukemias that I want to talk about. Acute lymphocytic leukemia, chronic lymphocytic leukemia, acute myelogenous leukemia, and chronic myelogenous leukemia. So I'm going to start off with acute lymphocytic leukemia, which primarily affects children. And some symptoms will involve, like a sudden onset, like you'll see bone pain, you might see some neurologic manifestations, and it's due to immature B or T cells. So the reason why this happens is there's a chromosomal aberration which results in abnormal transcription factors which adversely affect the development of B and T cells. So the results on the CBC, on the complete blood count or the smear, what you'll see is you'll see anemia, so you'll see a decreased red blood cell count, you'll see decreased platelets, so you'll see thrombocytopenia, and you'll see greater than 30% lymphoblasts on peripheral smear. Next, I want to talk about chronic lymphocytic leukemia, and this is the most common leukemia that occurs in adults. It can be asymptomatic, it can be, not really, it can be kind of non-specific symptoms. So you can see some lymph node swelling, some some spleen and liver swelling as well. And the reason this happens is there's a chromosomal deletion or hypermutation in naive B cells, and so you'll see involvement of peripheral B and T cells. And the CBC results will show some increased lymphocytes as well as low platelets. Next, I want to talk about acute myelogenous leukemia, and this mostly affects adults. So you'll see here anemia symptoms, some bleeding, maybe some red spots on your legs, indicative of bleeding within the blood vessels themselves. You'll see on the morphology, you'll see Auer rods, which are rods within cells, which are pretty pathognomonic for AML. Finally, I want to talk about chronic myelogenous leukemia, or CML, and this is rare in childhood. It's most common in ages 20 through 50. You'll see it'll be so clinically it could be an insidious onset with mild symptoms as well as an enlarged spleen. You could see white blood cells will be elevated to 200,000 to 1 million. It affects the tyrosine kinase pathway in the cells, so you're going to see altered chromosome called the Philadelphia chromosome, which is a 922 translocation.